First Aid Guide. What is first aid? First aid refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. Immediate skilled care given to the victim of an illness or injury before professional medical rescuers arrive. First aider is the person who renders above care. Why first aid is essential. 1. To preserve life. 2. To promote recovery. 3. To prevent worsening of the casualty's condition. 4. Arrange transportation to the hospital. Rules of first aid. Do. Attend the casualty immediately. Reassure the casualty and make him comfortable. Stop bleeding if any. Turn the face on one side if vomiting. Be confident. Call for help and start CPR if casualty is unconscious and non-responsive. Don't waste time. Do not attempt to move patient with an injured back unless necessary. Do not feed an unconscious patient. Do not remove the impacted foreign body like rod in the body or pencil in the eye. Do not panic. Danger, response, send, airway, breathing, CPR, defibrillation. Danger. Check for scene safety. Check for your safety chemical exposure. Check for casualty safety fire. Use personal protective equipment wherever necessary and available. Response. 1. Introduce yourself, if patient responds. 2. Ask for permission to give first aid. 3. Ask for following information, name, residence phone number and address, what exactly happened, and medical history. 4. Examine the casualty. Inspect the patient from head to toe. Note wound, swelling and bleeding. Treat in appropriate way. If the patient is not responding, immediately call for help and give details. Your name, phone number, exact location, what has happened, number of patients, condition of patients, nearest road, other necessary information. Do not disconnect unless told to do so. Check airway and breathing. If patient is breathing, inspect the patient from head to toe. Note wounds, swelling and bleeding. Treat in appropriate way. If no breathing observed, start cardiopulmonary resuscitation CPR. Initial assessment. A. Airway, breathing, circulation, disabilities and E. Exposure. Cardiopulmonary resuscitation CPR. Restoration of vital functions of the body, namely ventilation and circulation. Life-saving procedure where every second matter. The A, B, and C of resuscitation. Airway, open airway, breathing. Look, listen, feel, to breath circulation. Check for pulse, carotid pulse neck adult, brachial pulse mid-arm for infant. Compress external cardiac massage, push hard to 0.5 inch deep, push fast 100 min, push continuously, do not interrupt for less than 10 seconds. Artificial respiration, give mouth-to-mouth breathing. An appropriate and effective technique for emergency artificial respiration. Look, listen and feel for breath. Prevent tongue fall by head tilt chin lift manners. Do head tilt chin lift. Seal the casualty's nose to prevent escape of air. Take a deep breath. Open your mouth and widely. Place it over the victim's mouth and make a tight seal. Give 2 breaths after 5 cycles of compression. 2. Injury. Common causes of injuries. 1. Fall from height. 2. Slipped, tripped in floor. 3. Lifting or pulling heavy weight. For motor vehicle injury. 5. Electrocutions. Types of injuries. A. Wound and bleeding. Any abnormal break in the skin or the body surface which allows the blood to escape is known as wound. Wound skin cause. 1. Serious bleeding leading to death. 2. Shock. 3. Infection. 4. Damage to vital organs, brain, heart, etc. Classification of wounds. Open wound and closed wound. The types of wounds. Why first aid for wounds. Stop bleeding. Protect wound from contamination to prevent infection. To prevent shock. Get medical help as soon as possible. Bleeding, hemorrhage caused by the rupture of blood vessels due to severity of the injury. Bleeding can be classified as external and internal bleeding. Types of bleeding depending upon the blood vessel. 1. Arterial spurting. 2. Venous flowing. 3. Capillary oozing. Sign and symptoms of bleeding. Casualty feels faint and may collapse. Skin become pale, cold and clammy. Pulse rapid and weak. Breathing becomes shallow. Casualty gasps for breath and sighs deeply. Profuse sweating. Casualty feels thirsty and restless. Do. Get medical care if bleeding persists. Wear gloves. Apply direct pressure by thumb. Gauze pad bandage. Keep pressure at least up to 5-7 minutes. If first gauze is soaked, apply another gauze. Give pressure dressing. Do not remove dressing frequently. Do not remove soaked dressing. Do not apply anything on the wound such as turmeric, etc. Apply direct pressure and elevate the injured part and pressure dressing. Internal bleeding. When do you suspect internal bleeding? 1. Vehicular accident. 2. Blunt trauma to chest or abdomen. 3. Penetrating injury bullet or knife. 4. Pain in chest or abdomen after injury. 5. Blood and vomit. 6. Difficulty in breathing. 7. Symptoms of shock. Shock. When blood supply to brain decreases due to low blood pressure. 1. Uncontrolled bleeding. 2. Uncontrolled vomiting. 3. Diarrhea. 4. Severe allergic reaction. 5. Heart attack. Symptoms of shock. 1. Severe weakness. 2. GEDness. 3. Uneasy confused feeling. 4. Pale skin. 5. Wet and cold skin. 6. Difficulty in breathing. First aid for shock. Call for immediate help. Make the lay down. If no injury to leg, elevate both the legs. Stop bleeding. Keep the patient warm. B. Musculoskeletal injuries. Types of injury. Bones fracture, dislocation or both. Muscle sprained and tear. Tendons and ligaments strained and tear. Fracture. Break or crack in a bone caused by direct or indirect force. Dislocation. Partial or full displacement of bones at a joint. Sprain. Injury to the ligaments by excessive stretching or tearing. Strain. Stretching or tearing of muscles. How to suspect. Swelling, pain, abnormal position of injured part, restricted movement of the injured part. Your aim are to prevent movement at the injured site to prevent blood loss, movement and infection at injury site. To arrange removal to hospital with comfortable support during transport. If you can, get a helper to support the limb while you work on the wound. Cover the wound with a clean pad or sterile dressing and apply pressure to control the bleeding. Do not move the casualty until the injured part is secured and supported, unless in danger. Do not let the casualty eat or drink. Do not try to replace a dislocated bone into its socket. Precautions for open fracture. Do care for wound before you care for the fracture. Cut away the clothing over the wound. Apply direct pressure with a large thick sterile compress to stop bleeding. Bandage the compress in place. Do not replace bone fragments. Put it in a clean containers and send to hospital with the victim. Do not wash the wound or put your fingers in an open fracture becomes infected easily. Do not try to push bones back into place. First aid for shock with injury. Treat any wound. Pad bony prominences. Apply adequate splint to immobilize the joint above and below of the injured part. Check pulse, color and warmth of skin. Elevate injured part with sling. First aid for sprain or strain. Rest, ice, elevate, and compression. C. Spinal injuries. When do you suspect spinal injury? 1. Vehicular accident. 2. Fall from height. 3. Driving accident. 4. Multiple injuries. 5. Injuries to head, chest and back. 6. Electrical shock. The main danger is to damage the spinal cord. Spinal cord is composed of nerves fibers that pass message from brain to organs and other parts of body. If damaged can cause loss of power or sensation in parts. How to recognize. Pain in the neck or back, irregularity or twist in normal curve of spine, inability to move from lying position. If spinal cord is damaged. Loss of control over limbs, movement may be weak or absent. Loss of sensation, breathing difficulties. Treatment. Your aim is to prevent further injury and arrange urgent removal to the hospital with proper spine stabilization and immobilization. Do reassure the casualty and tell her not to move. Give support to the head in the neutral position by placing your hands over her ears. Maintain support throughout. Apply the collar. If unconscious, check A, B, C. Do not move the casualty from the position found, unless any danger. Applying collar. D. Eye injuries. Particle of dust or speck of dirt in the eye, penetrating injury to the eye, hit and blow to the eye, cuts to the eye or eyelids, chemical burns to the eye. Do. Wash under running cold water to remove dust, speck, in case of chemical injury. Apply cold compress over the area around the eye for reducing pain and swelling after hit and blow. Cover the eye with sterile pad in case of injury. Seek medical attention as soon as possible. Do not rub the eye. Do not remove the object embedded. Do not apply pressure on the eye. Do not use fingers to remove dust or speck. E. Dressing and bandages. Dressing is a cover of clean gauze or cloth placed over a wound to protect it. A compress, sometimes called a pad, is a thick dressing used to absorb blood and control bleeding. Bandage is tape that holds a dressing in place, provides support, and keeps injured areas from moving. Do. Wash small wound cuts thoroughly, dry with clean gauge before bandaging. Apply large dressing covering the edges of wound on all sides. Apply bandages over dressing to prevent slipping. Do not wash large wounds, deep wounds, bleeding wounds, and crush injury wounds. Do not apply the bandage tightly. Do not do dressing to the fingers or toes so as to check for swelling or any color changes. Do not use wet bandages. Bandage dressing. Medical emergencies. A. Heart attack, chest pain. How to suspect chest pain: shortness of breath, profuse sweating, giddiness, vomiting. First aid. Do not allow the patient to move. Call cardiac ambulance immediately. Let the patient breathe fresh air. Reassure the patient. Shift as early as possible. B. Fainting. Do. Make the patient lie down. Elevate both legs. Look for injuries if the patient has fallen down. Do not allow the patient to get up till she fully recovers. Transfer to hospital immediately. Do not let the patient sit. Do not give water or anything by mouth. Do not put onions footwear to his/her nose. C. Convulsions, fits. Jerky, abnormal movements of the body. Do make the patient lie down. Remove any obstructing furniture. Put a pillow or a thick bed sheet below the head. Call for help. After fit, stop. Check for airway and breathing. If the patient is breathing, turn him on one side. Do not hold the patient. Do not give strong stimulus. Do not put anything in the mouth. Do not give water. D. Stroke. How to suspect: sudden facial droop, unable to balance arms, trouble speaking, slurred speech, sudden numbness or weakness on one side of the body. First aid for stroke. Phone emergency medical services. Help victim lie down slowly. Note the time of onset. Transfer the patient as early as possible to the hospital. E. Choking. Partial or complete obstruction of the airway can be due to a foreign body. Partial choking. What you see: victim can make sounds and coughs. What you do: allow victim to cough. Stand by. Complete choking. What you see: victim cannot breathe. Victim cannot speak or make a sound. Victim use choking sign, clutches neck. What you do: give abdominal thrusts until object comes out or victim becomes unresponsive. If victim becomes unresponsive, start CPR. First aid maneuvers for choking. 1. Abdominal thrusts. 2. Chest thrusts and back blows. Give 5 cycles of back blows and chest thrusts alternately until foreign body is removed. F. Snake bites. Snake danger signs: pain and swelling at sight, drooping of eyelids, drowsiness, bleeding from wound, blurred vision, convulsions, difficulty in breathing, nausea and vomiting. Do. Scene safety. Ask the victim to be still and calm. Reassure. Immobilize the part. Wash bite area with running water and soap. Get medical help as soon as possible. Do not apply cold or ice. Do not apply suction. Do not cut the wound. Do not wrap the wound tightly or tie tourniquet. Do not waste time in hunting for snake. G. Scorpion bites, insect bite. Symptoms: intense pain at bite site, swelling at bite site, anxiety or restlessness, muscle twitching, increase heart rate or tachyarrhythmias. First aid for scorpion bite. Scene safety. Ask the victim to be still and calm. Wash bite area with running water and soap. Put ice bag wrapped in towel on the bite area. Get medical help immediately. First aid for insect bite. Reassure the victim. Wash bite area with running water and soap. Scrap the stinger with something having dull edge such as credit card. Put ice bag wrapped in towel on the bite area. Watch the victim for signs of bad allergic reaction. Dog bites. Types of wounds. 1. Only licks on intact skin. 2. Abrasions and licks on abrasions. 3. Transdermal for S. oliveri contamination. Management. Wash the wound immediately with water, then wash with soap and water or Dettol. Do not try to stop bleeding. Cover the wound with a sterile dressing. Send the patient to hospital for further treatment. Watch the dog for 12 to 15 days. Heat stroke. Caused by failure of thermostat in the brain. Body becomes dangerously overheated due to prolonged exposure to heat. Symptoms: confusion or strange behavior, vomiting, raise, hot dry skin, shallow breathing, convulsions, unconsciousness. Do. Send for help and medical help. Move the victim to the cool and shady area. Loosen. Remove tight clothing. Sponge or spray the victim with cool cloths and fan. Stop water and fan the victim. If victim stops responding, start steps of CPR. Do not wait to begin cooling. Do not continue cooling once the victim is normal. Do not rub alcohol or any other thing on victim's skin. Do not give anything by mouth if victim is unconsciousness, cannot swallow, confused or had a seizure. 4. Burns and scalds. Burns are injuries that result from dry heat, extreme cold, corrosive substances, friction or radiation, including the sun's rays. Scalds are caused by wet heat from hot liquids and vapors. Extent of burns can be measured according to rules of 9. Head and neck 9%, arm 9 each, trunk, front 18%, back 18%, genital area 1%, leg 18% each. Rule of 9s. Any partial thickness burn of 1 or less than must be seen by the doctor. A partial thickness of less than 9% will cause shock to develop and needs hospital treatment. Full thickness burn requires hospital treatment. Do. Cool burns immediately with water till burning sensation stops. Cover the burns with clean cloth. If clothes have caught fire, shot stop drop roll and put wet blanket to extinguish fire. Do not apply cold water or ice. Do not apply ink, toothpaste, ointment, oil, butter, etc. Do not open the blisters. Do not remove burnt and adhered clothes. 5. Exposure to chemicals. Route of exposure. 1. Direct skin contact. 2. Direct eye contact. 3. Inhalation. 4. Ingestion. Hazards. Skin irritation, eye irritation, inhalation effects, ingestion effects, carcinogenicity, mutagenicity. Sample of exposure to chemical. First aid measures. Scene safety for self and for the casualty. Bring the casualty to the fresh air or open environment. Look for respiration. If not breathing, start CPR. Remove all contaminated clothes from the body. Flush the affected area with large quantities of water. Wash the eyes in running water at least for 20 minutes. Do not induce vomiting. Do not give anything to eat or drink if unconscious. Medical attention as soon as possible. Thank you for watching.